Okay.
This is for you.
Postoperative pancreatic fistula is one of the most fatal complications after PD. This can lead to serious sequelae. There have been studies to develop scoring system for predicting POPF. However, there are no studies to build nomogram based on individual preoperative risk factor. Therefore, the purpose of this study is to identify risk factors for POPF and develop nomogram for predicting POPF by analyzing preoperative and intraoperative data. And finally, we aim to select patients who need more intensified therapy after internal validation of this nomogram and establish effective treatment strategy. The medical records of patients undergoing PD at Samsung Medical Center were reviewed retrospectively using multivariate logistic regression analysis. We found risk factors, and these were included in the nomogram. Internal performance validation was executed using a 5-fold cross-validation method. This is the clinical pathologic details. The male sex was 70%. And the subtextures of pancreas was observed in about 43%. Mean diameter of pancreatic duct was 4.2 millimeters. Most patients received duct to mucosa anastomosis and pancreaticojejunostomy. And pancreatic duct stent insertion was done in about 70%. The incidence rate of POPF was 12.5%. It is slightly lower than shared POPF rate reported by Calorie. Six independent risk factors were determined: male sex, high BMI, high ASO score, low albumin level, small p duct size, and location of tumor other than pancreas were significantly increased development POPF. Using this risk factor, we developed nomogram predicting for POPF. In the internal validations of performance, the EOCs was 0.709 for the train set and 0.6524 for the test sets, respectively. Using nomogram, we developed a web-based calculator for predicting for POPF. If you enter the information like this and click the info button, and estimated risk of POPF is displayed and expressed in bar graph, and you can compare it to average SMC POPF risk. Let me summarize this study. In our study, significant risk factors for POPF are male sex, high BMI, low albumin, and high ASO score, and small p duct size and location of tumor other than pancreas. And based on these risk factors, the nomogram and calculator for predicting POPF was developed. This nomogram may be useful in selecting patients who need more intensified therapy and establishing effective treatment strategy. And external validation of the nomogram will be needed in the future. Thank you for your attention.
Okay, there are some questions, some comments.
I have heard the report from your medical center yesterday, and are you from the same database?
What report? What data?
就是那个
Yeah, this in the core.
Because your people are 1,070 771.
Yeah.
And their people are the same.
Yeah, maybe
if they are your if these are 就是 they analyzed the significant risk factors is not include the texture of gland, but you have included it. how to explain.
You mean, you mean,
What is the question, please? Short. You understand?
Yeah, I
question?
understand, but maybe it can be different. But the important thing is, I think the texture of the pancreas is very subjective. So operation procedure, most surgeons just see, and they think, oh, it's hard or moderate or firm. So I think it is subjective. So I think that it is some problem. So I think I presumed, and the result of this our study that the pancreatic texture is not included in the independent risk factor for POPF. I just say about this.
is it correct answer?
I just want to know, do they use the same database? Because they have the same patient data, but the risk factors of pancreatic fistula are different. So I have a question.
Maybe there is some different statistical method maybe used, but I don't know exactly. Yeah, it can be answered. Yeah.
Okay.
Can it be-
Thank you very much.
Thank you for your question.